Migraines are a type of headaches characterized by throbbing, moderate to severe pain, lasting from hours to days, worsened by movement, accompanied by light or sound sensitivity, in addition to nausea or vomiting. In general, about 15% of the population are affected, with females being about 1.5 to 5 times more likely to suffer from migraines than males. The term acute migraine is used to describe a single migraine attack lasting for less than 72 hours long, while status migraine is used for migraines lasting for more than 72 hours. Furthermore, episodic migraine describes a migraine frequency of less than 15 days per month, while chronic migraine describes migraine frequency of 15 or more days per month for 3 or more consecutive months. The journey of a migraine attack typically involves 5 phases. Phase 1 is the attack generation phase, where your body begins to prepare itself for a potential migraine attack. During this phase, the pons region of the brain sends signals to the hypothalamus, but no symptoms accompany this phase. In Phase 2, known as the premonitory phase, your body senses an incoming migraine attack. During this phase, the hypothalamus releases dopamine, activating neurons, and you may notice changes in appetite, drowsiness, and irritability. Phase 3 is the aura phase, where your body experiences migraine auras. During this phase, neurons from Phase 2 send waves of brain signals, affecting the trigeminal and vestibular nerves, which play roles in facial sensation and balance, respectively. Some of the symptoms accompanying this phase includes visual auras, such as seeing halos or zigzag lines, sensitivity to touch, and dizziness. Phase 4 is the headache phase, where the trigeminal nerve releases chemicals that cause blood vessels to dilate, leading to moderate to severe throbbing headaches. Finally, Phase 5 is the post-headache phase, characterized by scalp sensitivity due to the lingering effects of a migraine attack. During this phase, pain-sensitive nerve fibers become activated, making the scalp supersensitive to touch. Next, we will discuss the different types of migraines. There are many different types of migraines, and each type will be discussed briefly in this video. The first type of migraine we will discuss is the migraine without aura. This refers to migraine headaches that are not accompanied by auras such as visual changes, numbness, increased skin sensitivity, limb weakness, or speech difficulty. Migraine with aura refers to migraine headaches accompanied by auras such as visual changes, numbness, increased skin sensitivity, limb weakness, or speech problems. These associated auras typically last from 5 minutes to 60 minutes. Basilar migraine refers to migraine headaches accompanied by stroke-like symptoms such as double vision, room-spinning sensation, vertigo, dizziness, imbalance, or ringing ear sensation, tinnitus. Vestibular migraines are migraine headaches accompanied by intense feeling of room-spinning sensation, vertigo, dizziness or ringing in the ear, typically lasting from 5 minutes to 72 hours. Ocular migraine refer to migraines accompanied by brief alteration or loss of vision on just one eye, not both eyes, typically lasting from 5 minutes to 60 minutes. Acephalic migraine is a type of migraine that occurs without accompanying headache, although the person may experience other auras such as visual auras, skin numbness, or hypersensitivity or limb weakness. Finally, migraine hemiplegia are migraine episodes accompanied by significant loss of limb strength lasting for less than 72 hours. But it is important to note that these symptoms can mimic stroke. So if you have any of these symptoms, immediately call 911 to go to the emergency room to get evaluated for a possible stroke. Migraines tend to be more common in females, especially young females between the ages of 29 to 40 years old. Furthermore, individuals with multiple family members with migraines will also have an increased risk of developing migraines headaches. Many different factors have been shown to trigger migraine headaches, but here are some of the more common migraine triggers: excessive caffeine use, cigarette smoke, eating aged cheese, alcohol use, estrogen-based oral contraceptive pills, strong odors, smells, or cologne. Other migraine triggers include loud noise, strong, intense, bright lighting, chocolates, especially dark chocolates, overuse of migraine medications, weather changes, especially when it rains or when the atmospheric pressure increases, menstrual cycles, emotional or physical stresses, not getting enough sleep, exposure to certain food preservatives, i.e., aspartame sweeteners, skipping meals during the day, and dehydration. Diagnosing migraines, including the different subtypes, relies on the description of symptoms experienced by the individual, knowing the symptom triggers, and by physically examining the person at the doctor's office. It's important to be aware that strokes can present similarly to migraines, with headaches accompanied by tingling or numbness. If unsure whether you're experiencing a migraine attack, do not hesitate to call 911 for further evaluation at the emergency room. The first step in managing migraines is to avoid possible triggers such as smoking, alcohol, estrogen-based contraceptives, strong odors, loud noises, and intense light. Minimizing stresses is also crucial. The second step involves making healthy lifestyle changes, such as drinking enough water, getting adequate sleep, avoiding skipping meals, limiting caffeine, eating a healthy diet, exercising, and maintaining a healthy weight. The third step to effective migraine management is taking medications as prescribed. Avoid overusing migraine medications, take them immediately when you feel a migraine coming, and keep a daily journal of your migraine attacks. Thank you for joining me today. I hope you found this information helpful. Let me know what health topics you would like me to cover on my next video. Don't forget to like and subscribe if you found this information helpful. Look forward to seeing you next time.